Hello physios, watch this video very carefully. As you can see, the moment she's opening her mouth, there's a clear deviation of the lower jaw. As you can see, there is a lateral deviation as well as the jaw is coming anteriorly. Okay, so this is known as locking of the jaw. So what could be the possible reason behind the locking of the jaw? So we have two categories. First one is your intra-articular problem, which consists of your disc, and second is your extra-articular problem, which can be due to external factors such as poor musculature. Second one is your muscle spasm, or if there is any kind of hyperactive or a hypoactive muscle in the jaw region, which is causing the lateral deviation of the lower jaw. Now this is the normal anatomy of your TMJ joint. As you can see, we have is the mandibular fossa on the image A, and just below it we have is the disc, and then we have a condyle, which is your convex shaped. So when we open the jaw in the second image, as you can see, the disc moves along with the condyle, okay, for the smooth opening and closing of the jaw. Now you understand the pathology behind clicking sound and the locking of the jaw. As you can see in the images for the clicking one, you can see the disc is not in the normal position, which is denoted with the purple color. It is anteriorly placed priorly, okay. So the moment patient is closing the jaw, the condyle moves posteriorly into the fossa, but the disc remains anteriorly. That is why it is causing a click sound. Now you understand what is happening with the locking case. As you can see, the disc is again anteriorly placed, so not in the normal position of the fossa. Now the moment patient is opening his or her mouth, you can clearly see the disc is now getting compressed between two bony surfaces. As you can see, the condyle is also compressing the disc with the upper bony prominence. Now when we talk about the extra-articular problem of the TMJ joint, it is majorly due to the pterygoid muscles. If the pterygoid muscles is hypoactive or hyperactive, it can cause lateral deviation as well as the anterior translation of the condyle. Because the pterygoid muscle, as you can see, it is connected with the articular disc. And save this reel if you don't want to forget these kind of technical details about the TMJ joint for your future reference, and do follow Physio Alchemy.